Hi everyone, Dr. Emeka here again. If you're new on this channel, welcome. Please click on the subscription button, turn on your notification bell so that anytime I drop videos, you'll be notified. So today I'll be discussing another type of seizure known as focal seizures. This type of seizures usually happen in some isolated area of the brain, some specific locations. So what happens is that the individual will be aware of the environment during this period, just as described by Dr. Jackson and his wife, that sometimes this seizure can spread to another location and then cloud the consciousness, and so there will be impaired awareness. So those seizures are sometimes called simple, partial, and complex partial seizures because they affect some specific location. Therefore, we shall discuss those seizures as it affects different type of location. The first one I want us to look at is the motor cortex area. There's an area in the brain called the motor cortex. So the motor cortex enables us to, move our arms, our legs, and our face as well. So if there's a seizure in this particular location of the motor cortex, then there will be shaking of the arms, the legs will be shaking, including the face as well, can be shaken. So just as described by Dr. Jackson and his wife, that seizures can also move and spread to another location, from one location to another. So you can have motor seizure clonic or atonic as well. In that case, there will be contractile ability that will be lost, and then the arms will just drop. Okay, that is about the motor cortex area. So let's look at another location in the brain. So there's a location that controls our emotion as human beings. That location in the brain is called the amygdala and the frontal lobe. So there are two locations that controls our emotions, the amygdala and the frontal lobe. So if there is seizure in this particular location, then there will be problem of intense anxiety and fear. The individual will have intense anxiety and they will be afraid. There will be fear as well that will grip them. So, and sometimes you can see the emotion so strong such that the individual can just burst and they will start crying. That is a form of seizure. You can see somebody that will just burst and start crying. It's a form of seizure. It's not funny. And then sometimes they can start laughing. Someone can just start laughing uncontrollably. It's a form of seizure because if there's a seizure in that location, the amygdala or the frontal lobe, the person will just start laughing uncontrollably. It could be a seizure that the person is going through. And so we need to be very careful in trying to differentiate between this seizure and anxiety or panic attack. So, because this seizure, like I explained, can spread to another location, and so that is one thing you need to know in terms of trying to differentiate it. You need to know that if it's a seizure, it can spread to another location. So the individual can start. They can pass on. Okay, they can pass out and then come back again. There'll be shaking of the arms and legs and all that. Okay, that is a seizure. But if there is no shaking of arms, legs, and all that, it could be an anxiety, due to panic attack. So that is what you see when someone have a seizure in the area of the brain called the amygdala or the frontal lobe. You see them with presenting with those kind of clinical features such as crying, sudden crying, laughing uncontrollably, anxiety, intense anxiety and fear. That is caused by seizure from that location. So remember, we're still discussing focal type of seizures. Another type of seizure is a seizure, sensory seizure. You know, when the seizure affect the sensory cortex in the brain, the area of the brain that is called sensory cortex, if the seizure affect that area, then because the area itself controls how we feel, our feelings and sensation. Okay, so if there's a seizure in that particular area, then you start having this tingling sensation, numbness, you have intense pain as well. So this seizure in this part of area is one of the most bizarre kind of feelings that anyone would have. Because the seizure in that area that controls our feelings and sensation, it's it's very important. So if you have seizure in that area, it's not a very good experience. So another type of seizure is a seizure from the frontal lobe. And the frontal lobe is associated with emotions, like I said. So if you have a seizure, or when there's a seizure in this frontal lobe, the individual will have this intense fear. They have facial grimace, they have this kind of jerking movement, especially when they just wake up from sleep. You see them screaming and shouting, running around, everywhere. They have this kind of paranoid behavior because that area controls our desires. They sometimes have this kind of intense desire. Any seizure in that frontal lobe, the person or the individual will have this intense desire. For instance, the person want to drink water, they'll be craving for water, like they are very, very tasty. They want to go to toilet to urinate, they want to pee immediately. That is the kind of feelings you get when you have these frontal lobe seizures. So another type of seizure is the one that affect the insula. There's an area of the brain called the insula. This insula is the autonomic function. Okay, it controls the autonomic functions of the body. So any seizure in that particular location of the brain would cause the individual to have this copious mucus, and salivation from the mouth, because the autonomic functions are this breathing, heart rate and all that. These are autonomic functions. And this area of the brain controls these things, you know how we breathe and all that. So you sometimes see them, they'll have this piloerection, like a goosebumps in the body. They sometimes have redness of skin. They experience hot flashes and all that. So rapid breathing or slow breathing. And these are all the things they can experience when there is seizure in that area of the brain called the insula. So another type of seizure is the seizure on the temporal lobe. Seizure on the temporal lobe is the one that uh, also have this impaired awareness. They are not aware of what is happening when they have that kind of seizure as well. So you just see the individual sitting down and they can start, picking up on the cloth just like this. They have what is called automatic behavior. Something they will just start doing this. For instance, speaking on the cloth in one location. They may sometimes want to try to undress their clothes, and you see them trying to undress for more than 10 minutes. Somebody is trying to undress the clothes and just trying in one location, trying to undress. You may sometimes see them, maybe they just clapping hand like this or hitting the table. They may be hitting the table or a desk continuously. It's automatic. They are not, they are not aware, but that is happening. It's a form of seizure. It's a seizure that happens in the temporal lobe area. It's automatic. It's called automatism, automatic behavior, picking up on yourself just like that, and then hitting the table, doing something repeatedly, automatically that you are not meant to be doing. It could be a form of seizure from the temporal lobe area. So another type of seizure is the one that affect the area of the brain called occipital cortex. The occipital cortex is responsible for the uh, perception of vision. So any seizure that affect this area of the brain called the occipital cortex, then the vision will change. You start seeing something like flashes of light or bubbles or some kind of vision or visual problems. That is when you have seizures in that area of the brain called the occipital cortex, which is responsible for the perception of vision. So seizure usually depend from individual to an individual. depending on the area of the brain where the seizure arises from. I hope you've been able to learn the difference between generalized seizures and focal type of seizures. So now that you know all this, during my next video, I would explain on how to control all these type of seizures, what to do, and the treatment that you need for it. Please, before you go, remember, click on the subscription button, turn on your notification bell so that the next video, as soon as I drop it, you'll be notified. Thank you for watching. Atutale.